morning, good afternoon, and good evening, and thank you for joining us for this Duke Global Health Institute Think Global session titled The COVID-19 Endgame, Where Are We Headed and When Will We Get There? My name is Krishna Udayakumar. I'm the Associate Director for Innovation of the Duke Global Health Institute and also serve as the Director of the Duke Global Health Innovation Center, and it is my great pleasure to be your moderator today for this fantastic discussion with amazing speakers that I will introduce in just a minute. To set context for what we want to talk about, over the last 20 months, we've seen a pandemic rage that's now led to almost 5 million deaths, over 240 million cases, trillions of dollars in lost economic activity, and a worsening of global inequities in almost every way imaginable. And yet we don't seem to have a clear plan of action, much less be moving toward fundamental changes in the way that we're responding to this global crisis. What we're going to talk about today is a brief reflection on how far we've come over the last 20 months, the challenges at a global, regional, national, subnational level to making progress, especially with the lens on what's happening in low and middle income countries, and really think about how we move this forward. What are the recommendations that we might come out with that will enable a stronger global response? Now, to help me with this conversation, I'm pleased to be joined by Dr. Yodi Alakija, who is the co-chair of the African Union's African Vaccine Delivery Alliance, has been really a leading voice on the African continent for access and equity. Secondly, with Dr. Ann Lindstrand, who's the unit head for the essential expanded program on immunization in the Department of Immunization and Vaccines and Biologicals at the World Health Organization. And third, by Alberto Valenzuela, who is the executive director of the Pan American and Para-Pan American Games Legacy Project, and in Peru has played a leading role in helping to support the national response to the global pandemic. Let's dive right in, and I'm going to bring in Ann to get us started. Ann has played a leading role in really helping think about the global response. She also co-chairs for COVAX, the country readiness and delivery team, and has really been in the midst of understanding incredibly complex situations in hundreds of countries around the world and figuring out how you bring global players to make a difference. So Ann, thank you for joining us today. And let me turn it over to you to give a sense of what we've done and where we go from here.
Excellent. So thank you for inviting me to this conversation. Looking forward to discuss with all of you, but let me give you 7 slides very quickly about where are we headed and when will we get there. The topic of today, of course, my eyes will be very vaccine oriented since I work both with the Essential Program on Immunization and on the COVAX in WHO. So excuse me if I don't see the big picture of the full response here, but let us just step back and say, where are we at the moment? We know that 6.5 billion doses have been administered around the world. Just amazing achievement in just 2021, and a few countries started in 2020. And that look at where we are now. All countries but 3 have started vaccination, and it's just an endeavor that has never ever been seen before. The complexities that countries have to deal with, the shipments, the different vaccines, it's something that the world has accomplished, which we should also be proud about. What we are not proud about is the appalling inequity of who has these vaccines and who does not have the vaccines. So if you look on the bottom left, 32 times more doses have been administered in high-income countries compared to low-income countries. On the top right, 47% of the total population across all WHO member states have had at least one COVID-19 vaccine. But if you look at the fully vaccinated and across Africa or AU larger, the numbers are too low to be proud of. appalling inequity that we're still staggering with, which we should have been able to mitigate before. The successes that I see here, I mean, the research and development, the private public investments that have made it possible to deliver all these 6.5 million doses is just amazing. The collaboration, the scientific minds, the sharing of data has been at the foundation for actually doing this. I think the global and regional mechanism for distribution of COVID-19 vaccines and procurement collectively together and sharing of risks and costs in COVAX and AVAT has been fantastic. I think that we will, in very, very short time, the next 3 to 6 months, the map of access of who has and who has not will largely be rewritten. And to a large extent due to these different mechanisms. And also just seeing the fantastic impact of these vaccines, the impact and effectiveness that we start to see, the decreasing risks of severe disease and mortality, right? What has not really worked, and I can't even see what I've written myself because the chat box is in a way, oh, there we are. We're still struggling with weak health and global health security systems that have not been effective enough to stop where we are today in the pandemic. The political commitment, vaccine nationalism, and what I, of course, worry a lot about because I work in immunization is the blow to essential primary healthcare services and including immunization that we've seen. If I step back and look at the year, a year ago about, we launched together in COVAX with all our partners and a lot of collaboration with other implementers, the VERA checklist, and then the NDVP, so the National Deployment and Vaccination Plan, to just, if countries want to use that, a way to plan and be ready. And then across the year, there's been a lot of delivery guidance and tools delivered. Training has been done, coordination and advocacy communication, implementation monitoring, data collection, sharing from countries, and lessons learned. And now we're back to the second version of NDVP when we know more about these vaccines. So this is just at the global level, together with a lot of partners, not just the COVAX partners, but well beyond, and with strong support from our regional colleagues in UNICEF and WHO, and other colleagues reading and contributing in all these different courses and guidelines being delivered and written. What we're moving from now is a lot at the global level, COVAX, is to try and work in bodies to support countries best we can in delivery. So, and in the background, we have a lot of data coming in from the COVAX partners, from other partners, from funders, from countries, in EGRF monthly modules. And all of these different dashboards you see on the top right is integrated, looked at, and we're trying to see what are the countries that are struggling the most. What can we do to support those lagging most behind? And you have them actually on the blue box on the right here. The ones that have not used the doses have been delivered and that have also a low uptake. And many of them are complex countries that may need additional partnership, collaboration, expressed from themselves what they need as a support. What we do is kind of zoom down on a few countries for extra work and support if they want, and try and see what could be the mitigation plan. Is there funding lacking? Is there TA needs that is needed? Whatever. What is the things that are lagging things behind? So what we're doing is implementation monitoring review and trying to see with countries the country action plans to support what can be done to deliver faster, as fast as possible. This is a slide from the regional office in Africa, who are also doing assessments of readiness in different dimensions, and also intra-action reviews micro planning and national deployment and vaccination plan, which the countries are doing, the country teams are doing. We see that a lot of countries are moving ahead in the planning stages, but there are still lacks and complexities, and I'll come back to that. One of the issues that we're working on is interaction review, and that is 2 to 4 months after implementation, encouraging countries to themselves do an assessment of, now we've done the assessments of introduction, what is the next, what did we learn and what can we do better next time? And here you just have a few from the Afro region of those first 10 countries who did these interaction reviews, which has been vastly useful actually. And we're trying to put together countries to share lessons between as well, both from the regional and global level. And you see that the best practices, those countries that have achieved best and been able to absorb fast the doses, are those with high political engagement and a very strong coordination mechanism. And then you can read yourself on the best practices. The challenges has been, of course, the short supply, but also the trickling down of doses, the confusion in the communication about when doses are coming. So how do you go on off in a campaign? How do you plan when you don't know if doses are coming next week or in 3 weeks? And when you really beef up communication then around trying to say that, we have a set up vaccination camp here and there. But you can also read the other complexities. Misinformation is one which is coming and going, but it's a strong bottleneck in some contexts. So where are we now? We're standing in front of a ramp up of doses, enormous, in Q4 and Q1 in 2022. It's going to be at least 4 times more. If you look up top right, left, top left, routine immunization delivers about 238 million doses in AMC countries. They did in the last quarter of 2019. And that will 4.5 times double with just the Q4 in 2021. So that's adding on the routine immunization, right? And the scale up that is needed, left down, is enormous in many countries. The daily scale up and the rollout needs to be ramped up by at least 10 times in many of the countries to be able to reach the goal of 40% population coverage by the end of December. And this is happening, as you were saying, Krishna, at the same time as economic forecasts say that the GDP per capita growth rate is challenging in many countries and many different contexts in high-income countries, but the worst in low-income countries, already starting from a lower growth rate. So this is a slide from Euro, which I really found interesting and mind-boggling and very, very worrisome. There are different kind of waves of socioeconomic impact, which we're just probably seeing the beginning of. First, loss of employment, economic impact on families, on enterprises, and then going towards mental health, difficulties in being able to respond to the needs of the hospitalizations needed, etc., but also longer term increased inequalities and long-term unemployment with all the risks that you could have there on security and other issues. So this is my last slide. Sorry for talking too long, Krishna. I just wanted to add a few things that really are needed at this point in time, and that we try to work with all partners and funders and actors, because there's a lot of willingness here. There's a lot of need for bringing all the best out of each of the global actors, of the regional actors, and having really the country teams at the center here being in charge, being able to do and the rollout as effectively as possible. Political commitment, funding, the tailored support that is needed, the coordination of all the support that is coming, but then looking also broader and ahead of the primary healthcare and healthcare systems that cannot be in the same shape next time we're having a pandemic. Same thing with the global health security, embarrassingly not fully working in so many countries, and that's why we're ending up in the situation that we are. I'll leave this slide, and I'm not going to go into huge number of the details here. That's too much. But I just wanted to flag up and bring this maybe back into the discussion. Thank you, Krishna.
Fantastic. Thank you, Anne, for such a comprehensive view and for helping us make sense of such disparate data and the work of hundreds, thousands of people trying to address this crisis around the world. Let me now move to bring in Jodi to this conversation. I've always admired the work that you've been doing over the last year and a half in really providing a strong voice for the Global South, for making sure that we are speaking truth to power, for identifying the continued gaps in the response as well, including in your role chairing the African Vaccine Delivery Alliance. So Jodi, please, love to hear from you on your view of what's been working and where the gaps are as we think ahead.
Thank you very much. Thank you very much, Krishna, and it's an honor to be here with colleagues. As I looked at the title, I don't have slides. I'm just going to speak extempore. But as I looked at the titles of the session, what is the end game? It really depends. I thought it really depends on where in the world you're sitting and what lens you've got on at any particular point in time. If you're in the US, the UK, the EU, and other countries in the world, you're looking at a very positive end game. COVID is over, and you're beginning to be over at least, and life is beginning to normal, and you're heading into the roaring 20s. You know, the lovely short dresses are coming back, and you're swinging, and you're all going to parties. If you're in the global north, south, sorry, and mainly low-income countries of the world, you're really looking at a world where COVID is going to become your future. COVID is going to become the disease of Africa, the disease of the low-income countries of the world, the continent where, for us in Africa, the continent perhaps where eventually they will say the deadliest variant of all emerged. But it would only have emerged because the world failed to do what was right in the moment that it was supposed to do it. So I mean, looking at Anne's with total envy at the presentation and what's on there, I couldn't help be a little bit, I don't know whether sort of slightly miffed is the word. When one hears all the time about the interaction reviews that are encouraged for African countries, the Afro slide and our review of how prepared are we and how ready are we, and what is the hesitancy? Did anybody ask the US to do an interaction review before they gave them more vaccines? Or did anyone ask the UK to do an interaction review before they got vaccines? And people have forgotten that we have been running vaccination programs, well, Anne certainly knows that because she's involved in immunization for decades on the African continent, very, very successfully. The US currently has probably the highest hesitancy rate. So for me, what is the end game? It was a really fascinating, it's one of the reasons I agreed to speak at this seminar, including, of course, to be able to be in this room with you, Krishna, and other colleagues. What is the end game? It's a fascinating term. Is the end game the grandbabies of variants that are growing on the African continent and parts of Latin America and other parts of the world where there is no social distancing because of that socioeconomic impact that Anne spoke about, where to all intents and purposes, when you walk out of the street, COVID doesn't exist because people cannot afford to socially distance. They cannot afford to buy and wear a mask. They cannot afford to stay at home. They cannot afford to do what you and I are doing and do Zoom calls. And yet there are no vaccines. Yes, we're hearing about vaccines coming a flood in Q3 and Q4. But the reality of that is that up to this moment, the forecast and the predictability of supply has been shocking, to say the least. I'm sitting in Abuja, Nigeria today, and I can tell you that Nigeria a couple of weeks ago had to suspend of Moderna vaccines because of short shelf life vaccines that had been sent from the US, from the UK and from Canada, because AstraZeneca had come in because there wasn't enough for second doses. It was running now into 4 months. We had to suspend Moderna for a while so we could quickly use up these vaccines, so that the media and the world would not come at us and say that you have wasted vaccines. Forgetting, of course, that there is also always in vaccinology, as has just been discussed in the previous seminar, there is always a 10 to 50% sort of sort of span allowed for wastage of vaccines. But all of a sudden, that is the story, because there are those who are beginning to think on the African continent that our lives don't matter, the low-income country lives don't matter, and the world doesn't care. This is not a moment to pat ourselves on the back and say how well. I have the privilege on Friday of facilitating the review and the strategic review session at the ACT Accelerator Council meeting, and doing a real deep dive into what exactly has the world done, how have we done, and it is that the world has failed. The world has failed. The global health system has failed low-income countries, has failed low-middle-income countries, has failed even the high-income countries of the world. In this moment of this pandemic, where we should have had global solidarity, we should have all come together. It has been about me, myself, and I. It has been about vaccine nationalism. It has been about vaccine apartheid. It's been about keeping those who are down further down and giving booster doses to those in rich countries. So I'm afraid the end game looks very different wherever you're sitting. And for us, the end game looks very, very bleak indeed. In Nigeria, as of today, I can tell you that 5.1 million people have received vaccine doses out of a population of approximately 210 million people. Of those who have been double vaccinated, who are fully vaccinated, only 2-point-something million, less than 1% of Nigeria's population have been double vaccinated. Nigeria houses some of the mega cities of this world, not just of the African continent. Imagine what is going on in those informal settlements, in those slum areas, in those really, really densely condensed areas of Lagos, Abeokuta, Abuja, Kano. We have a global problem. And I think until we recognize it as a global problem, until we stop this sort of there, it's okay, well, pat ourselves on the back, we're doing a good job, COVAX is doing a great job, and look, Q4, you're going to have more vaccines, so don't worry. We have to recognize what the problem is right now, we need to solve it. You know, enough of the congratulatory messages, and let us look ourselves in the eye and talk the hard facts of people who are dying on a daily basis. We don't even have the diagnostics data in Africa, so we're able to hide and say that, oh, it's okay, it's not so bad there, because people are slipping underwater quietly, drowning in silence. People are dying, families are mourning, the world has no idea that it's going on. Oxygen, I mean, I could go on, but I'm out of time. I'll wait for questions, but thank you very much for having me, and let's do better. Thanks.
Excellent. Thank you, as always, for helping us understand the situation on the ground, making much more viscerally known to us the urgency of the situation as we think about what the future holds, and certainly much more needed to be done and must be done going forward, and look forward to unpacking that as we go. Let me bring in at this point our third panelist, Alberto Valenzuela, who has been helping to lead the response in Peru. Peru is an upper middle income country in Latin America, and while COVAX and the ACT Accelerator and others have predominantly focused on supporting low income and lower middle income countries, there have been challenging circumstances as well for several upper middle income countries, especially with a high burden of disease like Peru. Alberto, let me turn to you now to give us a sense of the situation in Peru, what's worked, what hasn't worked, and especially how you and other leaders have come in also from the private sector to help support the response.
Thank you very much, Krishna, and especially I want to thank you very much for your kind invitation to you and the team of Duke and all the organizers of this seminar. First, I would like to present some slides, and I'll try to share with you a few slides because it's very important to know the behind the scenes of the vaccination in Peru. I lead a Peruvian entity, a public entity that was responsible for delivering the Lima 2019 Pan Am and Pan American Games. After that games, exactly 6 months after the end of games, this government entity shifted to become a logistic operator of Peruvian Ministry of Health as part of the country response against the COVID-19 pandemic. We built in few weeks. Temporary hospitals in Andean and Amazon regions, and supply oxygen equipment and systems for those facilities, providing more than 28 or 30 tons of oxygen per day for those hospitals. After a presidential impeachment and with a new government facing the second wave at the beginning of this year, we were called to be the official logistic operator of the Ministry of Health for vaccination strategy and for oxygen supply. But what does a logistic operator mean? What does a logistic operation? The logistic is behind any healthcare strategy and any public health strategy. Let me show you briefly what are we talking about when we mention the logistic operation, explaining the case of the vaccination strategy in Peru. Our case is part of all the strategy in the country. We often in Peru, we often know these kind of activities, these 8 kind. I'm going to try to. That's a point. Okay. Often we know this kind of activity, the infrastructure temporary, the crowd management, and the event services, the staff registration and logistics staff, and the cold chain logistics, and also the cleaning service, including access to those bathrooms and medical waste disposal, the transportation and food for staff, the main operating center, and all the operation, all the coordination around the venues, around the main centers, the large vaccination centers in Lima. It's a great job for many entities. Many entities are responsible for power, for water and waste. Many entities are responsible for the security around the venues. We're talking about, in this case, we are talking about 31 large vaccination centers in Lima, and we, with enterprise companies of the private sector and entities, different entities in different sectors of the public sector, we were integrating all these activities. We grouped in 8 activities: temporary hospital, the temporary infrastructure, and cold chain, logistics, crowd management, and security, and operating. All these activities that we call great code, following the terms, the usage terms in public-private partnership. All these activities was responsible for us, and many institutions were involved to deliver these logistics behind the vaccination strategy in these 31 large vaccination. It involved also 6,500 volunteers, people who engage with this strategy to empower, to improve the vaccination strategy for Peruvian citizens. This is very important. This is very important because one of our tools that we built all these systems for these 31 large vaccination centers. We were using the PMO and the integrated planning, 2 tools that we used in Pan American and Pan American Games in 1990. Yeah. But what the result, the outcomes of this strategy, of this logistic operation. all these logistic operations possible thanks to our experience as an organizer of mega events. We never thought that this experience would be used a response to the largest pandemic in our history. But beyond this radical, there is something very, very important in the middle of the second wave of COVID-19 and several economic crises. All the organizations involved in this great task have been building a new wave of Peruvian citizens who value better their relationship with public health services. This is a new relationship. This is a new area for the public services in Peru. Never in the past, never the healthcare was in the real center of the policymakers. All the impact of the pandemic and the healthcare and the public policies for healthcare was in the middle, was in the center of the discussion in the country. Collaboration between public and private entities has been growing over the months, the last 10 or 12 months. I think I would say that we have been learning how this collaboration improves the construction of a health system with better access, equity and quality of public service. Like all has outcomes of this of all these processes. We have 6.5 million doses administered. It represents 60% of doses applied in Metropolitan Lima in large vaccination centers, and it represents also 21% nationwide, increasing the productivity rate by 31 or 32% compared to the previous semester, the first semester of this year. But a very important, like I was telling you, is the satisfaction and engagement between the people with the healthcare system. Overall satisfaction with the vaccination process was very high, reaching a rating of 4.78 on a scale of 1 to 5 points, with a top to box of 96%, of satisfaction. But the vast majority, and this is another very important point that we find after this strategy. The vast majority, 92%, feel happy, hopeful, and proud with the vaccination process. This is a source of positive emotional well-being for people who get vaccinated. This is very important for us because if we make this between entities of public entities and the private entities who give us all the knowledge and all the ways that they have to empower, to improve our logistics processes, to import equipment, to better systems to deliver the vaccines between venues, and to work with the PMO and better tools to improve all the organizations of this strategy. For us, it's a very important achievement in our country. We have a long way to go. Yeah, we have to learn a lot of things, but we are learning, and that's important. In the middle of the pandemic, We were working so hard. We were working very, very hard to defeat this pandemic. But we have to recognize private companies from supply chain sector, the healthcare sectors, pharma, banking, innovation, and management consulting work together in this pandemic with the public sector. We, like a public sector, working together with the Ministry of Health and the people who was in the strategy with, for oxygen supply, for temporary hospitals, and for vaccine strategy was a very important example. How can we facing the next challenge that we have in the healthcare system and the public health?
Right. Fantastic, Alberto. Thank you so much. Amazing to see how quickly things came together there, and really the need to take a whole of society approach if we're going to address this as a true crisis and emergency, as you've shown is possible. What we've seen here is really some of the lessons learned and the pathways to move forward. Is that one, we have to continue to strengthen and deepen our multilateral responses. Two, we most certainly need to understand how to empower voices and leaders in low and middle income countries to lead that response. And three, we do have to think about all of the all of the resources we can bring to bear to make that possible. So if I could ask Anne and Yodi to rejoin the conversation, and we'll dive right into some questions and perspectives from all of you. And let me start with you. You ended your slides talking a bit about some of the work ahead. If you had to choose one or two things, how can all of us better serve the needs? How can we help strengthen the work that you and your team are doing with all of these partners around the world? What do we need to really make sure that we're accelerating everything that's needed to get from vaccine supply to shots in arms, especially?
Well, actually, Krishna, the real action is only happening at the country level, right? And as you were saying, Ayuri, many countries, not maybe in particular in Africa, but in many Asian countries as well, and in Latin America, there's a know-how, a knowledge about how to do mass vaccination campaigns. I think that what we all need to do is question ourselves and say, what does the country need? The country teams, what do they need? Have a really strong channel of the listening, being able to respond, but very quickly to the demands that are critical and very strong voices from countries on maybe, is it funding needs? Is it some specific TA? Is it maybe even political advocacy? What is the main support that might be needed, expressed by the country teams? I think coordination and not confusion. I think laying down all our different organizational hats and listen, and just make available the data and sharing the knowledge we have, and work as a global team more than anything else. I think the best knowledge is in the countries. They know what is needed, when it's needed, and so we need to open those channels for understanding and making it very visible then, and respond quickly, much more quicker than we've been able to do in so many other crises here. It's now or never. Over.
Thank you. Yodi, let me come to you to pick up on some of those points. And how do we make sure that we are changing the seat of conversations from Washington and Geneva to really be much more about what's happening at the country level, and that's where the conversation starts.
Yeah, well, I mean, thanks, Krishna, and thanks, Anne, for your great presentation earlier. I clapped when you talked about laying down our organizational hats and better coordination and less confusion. I think that is really where things start. And this takes me back to the lessons we need to learn from HIV/AIDS. I think we have failed to learn the lessons that we should have learned from the HIV/AIDS pandemic. I spoke a few weeks ago at the GPMB, Global Preparedness Monitoring Board, all these acronyms. That's the other thing we need to lose. We need to lose all the acronyms at the Global Pandemic or whatever Preparedness Monitoring Board meeting the other day, and said, this reminds me so much. I can't understand why we are in the same place in 2021 that we were in 20 something years ago with AIDS. There is so much more coordination that's needed, and and that is an excellent point. The reason UNAIDS came together in those years was because everyone needed to lay down their organizational hats. And so unfortunately, I'm old enough to remember and to have been involved as a junior in the Asia Pacific region with UNAIDS. I was chairing the thematic group at that stage on AIDS before it actually, as it was being formed into UNAIDS. I was chairing that group at the time, and I remember literal fisticuffs in some of the meetings as UNICEF and WHO and whoever would say, no, me, I'm at the fore, no, me, I'm at the fore, and that added to the confusion. So we do absolutely, I agree, we need to lay down organizational hats, and we need to speak to a stronger coordination of this issue going forward. Where do we go from here? Where we go from here is we need to fix the governance. When you say you want to hear more from the countries, the reason you're not hearing more from the countries is because there are very few people from the countries that are involved in the governance of these things. So when COVAX decided arbitrarily, I might add, at the beginning of this, that we're going to serve 20% of populations, how many conversations did they have with us? I co-lead the Africa Vaccine Delivery Alliance. That's 55 member states. We were not really part of that conversation. It was told to us, a very paternalistic view, a very colonial attitude of this is what we're going to do. So we're speaking in a moment that needs global solidarity, but what we have had is charity, a charity model, not a partnership model. And until we lose the charity, until we recognize that, as Anne says, that there is strong capacity on the continent, be it of Africa, Latin America, or in parts of Asia. I mean, look at what Fiji have just done, for instance. I talk about Fiji all the time because it's the other half of my life. It's my daughter and husband are Fijian. They've done an incredible job, over 80–90% vaccinated so far. Incredible rollout, using local knowledge, using traditional leaders, and just it was an all of country, all of society affair. They did it themselves. It wasn't even COVAX, because quite frankly, there were no vaccines. So it then came to production and bilateral sort of donations from Australia, which had production next door, which was able to help them protect their population. So today, I believe the country is open for the first time. I can finally think of going home there for Christmas this year, perhaps, and life and socioeconomic recovery can then begin. There will be no end game for countries until we have equity, until we have greater inclusion, and until we have some health justice for all.
Thank you. A powerful message. Alberto, building on that, let me, come to you. In addition to sort of empowering country voices, how do we capture those lessons learned? We heard from Yodi, we also heard from Anne that much of this knowledge exists at the national level, not at some global organization, especially what you've done so successfully in bringing a private sector perspective to be able to augment and collaborate with the public sector. What are your thoughts on how we capture lessons about what works, what doesn't work, and share it with others? Because that we also need to create a stronger knowledge sharing mechanism to try to improve our recovery.
Thank you for your words. Thank you for your words, Krishna. I agree all the words of Anne and Ayori. I think the best way to look forward, looking for the end of this pandemic, we talk about the coordination and integrate many sectors, not only the healthcare sector, not only the health ministry, not only the leaders of the public health sector. We're talking about to involve, to coordinate many sectors, but how can we do that? I have tried to show you a case that we coordinate and we work together with tools, the PMO and the integrated planning, where was a strongest tools to improve these processes, because it's not only to talk, it's not only to coordinate. It means we have to deploy and implement all the processes to make it real, all the public policy, and it means tools for us. And one of our powers in this case are the tools. If we don't have work, if we don't work with tools, the private sector or the public sector, they are not going to coordinate well, and the outcomes are not going well. And the first goal, the first objectives of all these coordination is to make a new citizens, a strong citizenship, and engage between the citizens with the public sector, especially with the healthcare sector. Then, after that, we are going to have a strongest and stronger healthcare sector for against any pandemic in the future.
Great, thank you.
Can I ask Krishna?
Please.
It would be great to hear what Ayodhya would say as well with involving the private sector in Africa, because I'm sure there's because the ramp up, for example, of capacity and staff, both for logistics and security, everything that is needed around data handling, etc., doesn't have to be the health sector, right? You could involve much larger and so on. How are you thinking about this from your side, horizon?
Thanks, Anne. I mean, I am very much a proponent of private sector involvement and participation in be it health, be it education, because as I said, the whole society approach. So when you talk about the logistics, data management, the only examples I have within this pandemic is from the UK, where my daughter lives, and so I was there when the vaccinations were ramping up and looking at the massive private sector involvement. I mean, if there was one thing the UK got right, it was vaccinations. They got the rest of it pretty much horribly wrong. But the vaccinations rollout was incredible, and that was what you're talking about. It was volunteers. It was Westminster Cathedral became a huge vaccine site. And people from private sector were giving vaccinations. The Science Museum and History Museum were co-opted, and they became vaccine sites. This is what we need to see. The health sector cannot see this, but I can't do this alone. But I think part of what we've done is we've messaged this pandemic wrong. I think we messaged it as a health pandemic, but it is not. It is an all systems pandemic. It's a socioeconomic crisis. It's a health crisis. It's a political crisis. It's a gender crisis, for goodness sake, because girls have stopped going to school and are being married off, sold into marriage and sex slavery. So we need private sector involvement. We need to stop messaging it as a health crisis. I advocated very strongly for the UN General Assembly to stand up and do more for other people, my poor brother Tedros, who has been screaming and yelling. I'm sorry, you're sitting there at the wonderful WHO. This is not your problem. It is a global problem. You should not have to carry it alone. That it's a virus that has caused global significant consequences and disruption globally. It is going to cause disruptions and significant stress on our global peace and security. I've just done a panel where I talked about what it's doing in Africa with peace and security. You know, it's not just a health security problem. So when you think about it like that, you have to bring in the private sector. We have to take off our doctor hats. I mean, I'm medically trained, I'm a medical doctor myself, but I don't agree that we look at this from a health lens. I think we look at it from a whole of society lens, and we also solve it from a whole of society lens. It's fascinating to hear the amazing work that has been done in Peru, you know, with logistics and what have you. If we did that with vaccines, for instance, we will ramp it up. But because it started with WHO, back to your country examples, and, you know, ministers of health have now said, oh, well, this is my territory. You know, and so anybody else trying to get in on that territory, no, Tedros said, WHO said, it is my territory. And we need greater leadership from the global level and also from country level to, you know, we're trying it at Africa Vaccine Delivery Alliance. I mean, it's a multi-sector alliance, CSOs very much in the lead, you know, the risk communications and community engagement pillar for that is led by the African Alliance, which is a CSO. You know, we have sector. I work with DHL and the various other delivery people. They're not necessarily bringing vaccines to us, but they're providing me with intel. They're ringing me every day and saying, hey, Dr. Yodi, this is what is moving around this continent of the world. You know, hear about it. We're working already with private sector, but we need it to be more systematic and to be more coordinated across the continent.
Well put, thank you, and great to get into that in a bit more detail. Unfortunately, we're getting close to our time, although I feel like we're just starting in this conversation. I could keep going, but let me turn to some final thoughts, and I'll shift gears a little bit. First, a huge thank you to all of you for participating. We have a lot of students in the audience. We have a lot of global health students and others, especially. Based on what we've talked about here, your experience, what would your piece of advice be to students? How should they think about the role that they can play as change agents, and how they can think about the role that they can play in a changing world? Anybody that wants to jump in?
Yeah, we need the voices of the young to push forward on this unacceptable vaccine equity. I think, you know, pushing and advocating, I was hugely frustrated. I came back to my own country, Sweden, a couple of weeks ago for a conference, and they were talking about booster doses, and now we should vaccinate children and this and that. And I said, what are you even talking about? It's not time yet. You know, you have to be looking at the global response to the global pandemic. And this is where you can also have the global health. I know when I was a young, you know, doctor in global health, I also had that, you know, screaming, passionate equity feeling in that I think drives a lot of people wanting to work in global health. And so use that energy, young, and advocate for a massive failure that we're seeing right now. That's what I would say.
Thank you, Anne.
Krishna, yes. Thank you very much for all. But I just want to say something very important for us. That was very important for us, and it was the information. In our country, at the final of the last year, we didn't know how the running for get vaccines. We didn't know about that in Peru. And after the weekly report that we had in Peru, the weekly report made by Duke and the team, that is very, very important information for the decision makers in Peru and for the citizens also, because the citizens have the power when they have information. When all the information about how the world, how the countries are getting vaccines was known in Peru, the citizens make a lot of complaints to the past government. And that's a very important point, and I want to say that because the information must be for the citizens, not only for the decision makers, because we have to empower the citizens for question the governors or the government to get best policies, especially in healthcare and facing the next challenge that we have.
Yeah.
And thank you very much, Krishna, and I'm very honored to be with Dan and Judy in this panel.
Fantastic. Thank you very much, Dr. Yodi.
Well, I was going to say very quickly that the current pandemic, alongside climate change, which is another issue that is gripping the world, which is the next one that's about to take us out, has caused disruption on a global scale, and social movements around the world have been born out of major disruptions, and those usually are led by young people. So speaking to your students, you know, that fire that, you know, I somehow still have the energy to have in my belly for, you know, the sheer injustice that how can we allow this to happen? You know, if we can impart something, at least I can impart something to them today, it would be to understand that yours and your generation are the ones who can drive that level of change. You're the ones whose voices will make the difference. You're the ones whose voices will help the world to understand that, you know, Latin American lives matter, African lives matter, Asian lives matter. It's not just our lives in the West that matter. And to answer that very quickly, somebody has said, shouldn't the health sector lead? I think there is a moment in this crisis where we need to recognize the sort of work that was done with UNAIDS. You know, the Peter Piot's of this world, when they got together and they put together UNAIDS. We need something like that again, not necessarily underneath the UN. Yes, it was led by global health leaders in some respects, but it was multi-sectoral. It had involvement of those most affected. You know, I say we should start talking about people most affected, people living with vaccine inequity, like we talked about people living with HIV/AIDS, and include them on the boards of COVAX and ACT Accelerator, etc., so that there's inclusion and those voices are heard. But back to voices, your young people, your students, you know, I would like to be a student one day. You know, but your young students, what we need from them is we need that voice. We need them to agitate for change and to make the political leaders, as Alberto just says, we need them to make governments and political leaders accountable. Thank you so much. It's been lovely to be with you, an honor to meet you, Alberto. Nice to see you, and thanks, Krishna.
This has been fantastic. Thank you so much, Yodi and Alberto, for spending your time sharing your guidance, your insights. I've certainly come away much more knowledgeable about potentially the path forward. And a huge thank you to the Global Health Institute and the team, Michael Penn, Emily Bakir, Melissa Slogan Estrada, Lee Walls, that have helped us pull this off from a communications and logistics perspective. I'd say when we think about the end game with COVID, what I've heard today is we need to recognize first that we're probably closer to the beginning than to the end of this pandemic. Second, this is a global challenge that's going to require a global response. We may think that different countries or different regions can get back to something close to normal sooner rather than later, but that's certainly not going to be the case, as we've seen over and over with waves of infections and variants. And that response has to be grounded both in equity, much more equity than we've seen so far, as well as a much greater sense of urgency, recognizing the real challenges on the ground. We also heard that, yes, this is about health, but it's about much more than health. We've got to have a whole of society response to a true global emergency. And that starts with governance. We need more transparency. We need more accountability. We need more participation and inclusion in the models by which we put these solutions together. And we heard so much about the ways that we can learn from partnerships, whether it's the public and the private sector, a cross-sector model for participation. So if we are going to try to accelerate the end of this pandemic and see an end game that's more positive than we're looking at now, we really have the tools and the knowledge to do so. Now it's up to us to figure out how to make this happen in terms of political will. So thanks to everyone that's joined us today. Thank you especially to our esteemed panelists, and let's all go forth and do our parts to end the pandemic. Thank you all, and have a good morning, afternoon, and evening.
Thanks. Anne, I'm going to contact you. Let's be friends.
Yes. Okay, great. See you.